Good afternoon. I am Cynthia Brown, the nursing student advisor, and I want to thank you all and welcome all of you for coming today. This is a very important celebration for our 2022 nursing graduates who are on the brink of entering nursing careers. Since coming to South Suburban College, they have completed so many milestones, from being certified nursing assistants in our CNA program to taking pre-nursing courses, math and sciences. During their journey, they have been tested in so many ways. I think they'd agree. In the classroom, in the lab, and in the hospital settings, just to name a few. Many have already accepted internships at some of the community hospitals. And we, the faculty, are confident that they will complete their nursing goals of working in the hospital settings. Lastly, I would like to mention several of our students are participants in the National Student Nurses Association. They have conducted such things as fundraisings. They have collected items and donated to the less fortunate and to women's shelter. And with that, I would like to introduce Ms. Buckhalter. Ms. Buckhalter is a member of the Nursing Student Association. She is our vice president and treasurer.
Good afternoon, everyone. Reverend Dr. Marietta Herbert Davis is a native of Chicago, nurtured in the Inglewood and Outgale Gardens communities. She is the oldest of 6 children, the mother of 2 adult sons, and a grandmother. Marietta became an active member of Trinity United Church of Christ in 1988. She loves to sing and has been a member of the Sanctuary Choir for 25 years as a second soprano. She answered the call to ministry and was ordained as a deacon at Trinity in 2007 by Reverend Dr. Jeremiah A. Wright Jr. She also served as a member of the Wednesday night prayer service team under the leadership of Reverend Dr. Otis Moss III. Marietta believes in education. Study to show thyself approved. 2 Timothy 15. She was a licensed practical nurse, which she received from William L. Dawson Institute in 1980, and she also received a BA in English from the Chicago State University in 1989. She later became a registered nurse, receiving a BS in nursing from Chicago State University in 2002. She also has a Master in Pastoral Studies from Loyola University, which she received in 2010. She has a Master's in Divinity from Virginia Union University, which she received in 2013. And she also has a Doctorate of Ministry from McCormick Theology Seminary, which she received in 2021. Her doctoral thesis project is titled A Collaborative Trauma, Informed Awareness Training and Resource Tool on Domestic Violence and Sexual Assault for Congregations. Her favorite scripture is Isaiah 40, 28-31. Her favorite hobbies are swimming, fishing, traveling, and dancing. Marietta loves being an ordained and installed pastor and a humble servant with the United Church of Christ, serving God's people and a healthcare educator. Please help me welcome Reverend Dr. Marietta Herbert Davis.
Good afternoon, everyone. It's so good to be here, and it is such an honor to be here. And so I want to thank Dean Dr. Linda Brown Aldridge for recognizing me and accepting me to come here and speak to you all today. Thank you very much. I want to thank Professor Cynthia Brown. Thank you very much for recommending me, and I want to thank the staff, families, and students. It's a privilege and an honor to be with you today. For a moment, I'd like everyone to stand and give the students a hand that they made it through these nursing courses, tests, quizzes, clinicals, SC, icons to this day. Now, students, I need you to stand up and give a hand to your faculty, family, friends who encouraged you, supported you, and prayed for you to get to this day. As a nurse of 40 years, it brings me great pleasure just to talk about a few things with you today, and then I'm gonna get out of the way. All of us sitting here are still sitting on the edge of our seats about the COVID-19 pandemic and the Delta variant and the other viruses that have plagued our nation. We pause in silence right now for the families who have lost loved ones to COVID-19. Thank you. Please know I'm not trying to offend anyone with my religious beliefs or language. I'm just here to tell a story. So I have 3 points that I'm going to leave with you today. And as I said, then I'm going to get out of the way. My first point to the nurses: treat all people with dignity and respect. There's no exception to cultural backgrounds or race or socioeconomic statuses or LGBTQIA. No exception. Before I became a registered nurse, as you heard, I was a licensed practical nurse. I was happy to get my first nursing job, paying $6 an hour. You heard what I said. I arrived on the medical surgical floor in the hospital for my first nursing assignment. I was assigned several patients, and the first admission, things were going well, and my patients were even having a good day. And I joked with one of them because he wanted me to wash his private parts. You see, he was a paraplegic, and it wasn't nothing wrong with his hands. Okay. My first admission arrived on the floor. She was an African-American female, and she was about 80 years old. She was transferred from a nursing home. She was conscious, not conscious, but she was breathing. She wasn't groomed, her hair wasn't combed, it was in knots, her fingernails were brittle, and dirt was under her nails. She had all types of tubes connected: an NG tube, Jackson Pratt Foley, an IV tube, a G tube. She weighed less than 100 pounds. I looked around for help, but all the nurses were busy. Then her adult children arrived in the room. I remember one smelling something a little bit like alcohol, yet unkept clothes. One was talking about getting the keys to the mother's house so that she could see if there was an insurance policy. One was talking about who's gonna pay for the funeral. One daughter had many gold chains and bracelets. She looked at me and said, "When is all this gonna be over with? I need to get back to work." They didn't even look at their mother laying in the bed. I backed out of the room and ran to the bathroom. Tears rolling down my eyes. I wanted to scream out loud to God because I asked God, why do I have to clean her? This is not what I signed up for today. God said to me, she is coming to see me. I walked out of the bathroom and gathered all my supplies. I put on all my PPE isolation equipment and masks because I didn't want the family to see that I was crying. I politely asked them to leave the room so I could care for her. I gathered all my towels and washcloths in a basin. I combed her hair, cleaned her nails. When I finished, she was beautiful. I said to the patient, "Now you can go and meet Jesus." Little did I know my washing and rinsing of my patient could have been a sign of possibly baptizing her. I don't know. I just knew I did not want her to meet Jesus that way. My internal intentions were to make sure that her body was clean. But God wanted me to prepare her soul on the inside. So through my tears and my praying, little did I know that she was going to make her transition that day. I prepared her body to meet Jesus. Now, I won't say that it took 3 times for me to change the water, which would not be true. But I do know that I washed and I rinsed in the name of the Father, and the water was still cloudy. I washed and I rinsed in the name of the Son, and the water was still cloudy. I washed and I rinsed in the name of the Holy Ghost until the water cleared. When I returned from lunch, my patient had made her transition. She had died. Her children were in the room when I entered. One by one, they began to thank me. And they said, "She looks beautiful." Tears rolling down their eyes. The daughter took off one of her bracelets to give to me, and I said, "No, thank you. Your mother has given me a gift." The gift she gave me was worth more than silver and gold. I am a registered nurse, and you heard that I am an ordained pastor. Perhaps God called me because of my first nursing admission some 42 years ago, when I treated my patient with dignity and respect, knowing that I would never hear her say, "Thank you." Always remember, you are never by yourselves. Now, reflecting on some good times, trusting the process. I want y'all to think about some of the days that you had, clinical days, school days, trying to make sure that you arrived at the hospitals and nursing homes on time. Your car breaks down, you need a battery, and you had no money. You had more bills than money. Forgetting your uniform or proper shoes to wear. Forgetting to research ahead of time to know the plan of care regarding the patient you were assigned to. Laughing at yourself when you had a brain freeze because you couldn't recall the information you had studied. But the information came back to you at the last minute and you passed the quiz and the test. You had many thoughts about telling your professor, "My dog really did eat my nursing care plan. My internet did really go down. My laptop really stopped working. And the kids really did spill juice, water, pop on my paper. And yes, I forgot to save my information on a flash drive." Remembering all the times some of you had to go to the bathroom just to cry in the stall so no one could see you. Then you came out the bathroom, you took a deep breath in, and you said to yourself, "I can do this." You went through all the winding roads, all the doubts and fears, and the days you wanted to quit. But quitting was not an option. You made it. Give yourselves a hand. You made it. And say out loud with me, "I was never by myself." My second point is on critical thinking skills. Learning does not end here. What is the best practice? What is the best answer? The courses that you have studied and you're going to be tested on by the state of Illinois to pass that NCLEX, that National Council Licensure Exam for Registered Nurses. Passing the NCLEX proves that you will be a competent and safe nurse when providing care to your patients. Those questions will come from the courses that you study. What does it mean to critically think as a nurse? Assessing, using that nursing diagnosis, planning, implementing, and evaluating the best practice, and the most favorable outcome for the patient. Remember those nursing theorists, Florence Nightingale, Virginia Henderson, Jean Watson, Dorothea Orem. Don't just leave them out your head, but pack them in. Fundamentals, foundation of nursing skills, med-surg, including pathology of viruses and diseases, knowing how those diseases affect the body. Pediatrics, understanding human growth and development for children. Obstetrics and gynecology, understanding women's health. Developmental growth of the mother and the baby. Currently, our country is fighting for women's health. Pharmacology, a comprehension of how medication works in the body. And psychology, comprehending the sensitivity of mental health challenges of what people are struggling with daily in their lives. When you intentionally prepare to study for the NCLEX, but not by yourself, remember these areas that you must understand to keep your patients safe. Management of care, safety and infection control, reduction of risk potential, health promotion and maintenance, psychosocial, basic comfort and care, psychological IV parental treatment, and physiological adaptation. My third point is your self-care, your healthy mind, your healthy body, your healthy spirit. It's a book that I read going through seminary by Henry J.M. Nugent, and just paraphrasing him, he said that if we are hurting and if we are wounded and if we have never gone to anyone professionally to help us get through stuff, instead of helping our patient, we will hurt them and we will burden them with our stuff. There's no time on this earth that you will not go through trials and tribulations. Please know that your patients are going through life's challenges, knowing that they are relying on you for your assessment skills, providing comfort, support, knowledge, working with that collaborative team, medical doctors, nurse practitioners, LPNs, the lab, the x-ray, respiratory, dietary, social workers, medical assistants, physical therapy, billing, all of them to help you get through, to help your patient through their illnesses, diseases, miscarriages, trauma, sexual transmitted diseases, domestic violence, sexual assault, surgery, deaths, and the welcoming of new lives into family. And it's many more. A comforting hand to hold, even if it's through a glove. Loving eyes when you cannot see a smile on your face due to the mask that you have to wear. A caring heart and the tone of voice when you're giving discharge instructions to a patient, family, or friends. Know this, you must maintain your self-care. You are not a robot. Some of you are mothers and wives and husbands, significant others, daughters, sons, grandparents, friends, neighbors, and heads of households. As you care for others, always remember to take care of yourself. Remember to allow your children and wives and husbands and significant others to learn how to take care of you as you are taking care of them. As nurses, we shouldn't feel that we should be super nurses. You want to always remember that you're working in a collaborative team. Take your time when administering medication. Call the pharmacist. Ask questions. Consult a colleague. Say it with me again. I am never by myself. As you are being pinned today, I need you to consider what you said yes to. You said yes, that you would carry the characteristics of a registered nurse, of a person that has compassion, empathy, sympathy, kindness, and love to make a difference in the lives of people who are at their most vulnerable times in their lives. You are standing on the shoulders of ancestors in your family and others. Mary Eliza Mahoney, and she became one of the women to finish the program, making her the first African-American woman in the United States to earn a professional nursing license. There was 42 students in her class, and when the class was ended, only 4 were standing. She was the only one. She was in that 4. Then there is Kafo Oroli Abini Pratt, and she was a Black nurse that's in Nigeria, and she founded a nursing program in Nigeria, and she was the first one to be trained at a school at St. Thomas in London. Know that there's a Dr. Murillo Road, and she founded the nurses for the National Association of Hispanic Nurses, and she received one of the highest honors, that a fellowship from the American Academy of Nurses. And gentlemen, I haven't left you out. There are 6 male nurses in history you should know, but probably don't. Saint Camillus de Lillis, and I'll let you look that up later. Second Lieutenant Edward Lyon, Joe Hogan, and I want to talk about Joe Hogan. Joe Hogan had applied to the University of Mississippi for women, and he was denied. He had to take his case to the Supreme Court to say that he was discriminated against. And the court ruled in favor in 1982, ending school sex discrimination and publicly funding nursing schools throughout the country. That's why you're here today. Luther Chrisman Russell Transbarger, James Derman. James Derman was also a slave, and he worked with some physicians, and he worked very well assisting them. And his salary afforded him to pay for him to become a free slave. And then later he became a physician. In closing, treat all people with dignity and respect. Apply your critical thinking skills. Take care of yourself. Remember to be the listener, not the talker all the time. Remember to be the teachable nurse who has come in with open minds to say, I'm ready, I'm a sponge, I want to learn all that I can. Be the optimistic thinker, positive attitude about your future and the future of your patients. Celebrate this day. You enrolled in the best nursing program at South Suburban College with the greatest nursing faculty to put fire under your feet. They educated you. They empowered you to comprehend critical thinking skills as a registered nurse as it relates to theory and clinical. I look forward to hearing all about you continuing your education as leaders in the nursing field, not only helping your family, friends, and community, but globally. Best wishes to you as you pass the NCLEX and join a respected health career with thousands of registered nurses across the United States and globally. Say it with me one more time. I am never by myself. Congratulations on a job well done. Enjoy your day, and thank you.
On behalf of the nursing class of 2022, we would like to thank you for your words of encouragement today. We want to present you with the gift.
Thank you.
Ms. Area.
Thank you. I said, I gotta watch out. I got on cute shoes today. Oh, thank you. Thank you. Thank you very much. Thank
I would now like India. She is going to say a poem for us today.
Good afternoon. How's that? Okay. So I have a poem for my fellow classmates. It's called A Graduate Blessing. So much hard work and determination have brought us to this point in our life. What was once just a dream is now a dream come true. We invested our heart in this challenge and had some fun along the way. But the road to success was not an easy one. It never is. It was paved with sharp turns and steep hills, but we held on to the wheel and kept going. We should be so proud of that. Today is a day for celebration, a day to celebrate the lessons we learned and the friendships we made along the way. It's a day to acknowledge the past and embrace the future. Many dream, some try, but only a few achieve. We worked hard, went the extra yard. We had a goal and gave it our soul. And now that day is here, and we can finally say, we did it.
We will now begin our pinning ceremony with Dean Aldrich, Dr. Gina Haynes, and Dr. Sandra Curry.
Hello, everybody. I just want to say one thing. This is success. They came here 2 years ago, and I met you guys, and I told you, look to your left, look to your right. The ones who want to be here and be successful will be here. So this is success. That was where you are 21 years ago. Keep it going. Keep your education going. And with that, we're going to go ahead and start the names. Adisha Washington Brown. Alexis Garza. Aaliyah Muhammad Anderson. Eamon John McGee. Andrea Williams. R.E.L. Thompson. August Love. Benjamin Loza. David Basil. Elizabeth Krause. Herman Curtain. India Poe. Latasha Balcotter. Malika Muhammad Stewart. Yes, there are two Muhammad sisters graduating today. Megan Ayala. Makia Stewart. Patience Gray. Ryan Nicholson. Jahona Irma. Tamatra Dixon. Those are all of our graduates.
Okay, we will now have the lighting of the candles with Miss Diane and Newman.
Good afternoon. I want to first say to the graduates, it has been a pleasure working with all of you as the remediation specialists. I am still here for you all. I will be watching what you all are doing on Batty. That is my job. And I will be getting all of you all's personal email. If you're not working, I will email you or call you. That is my job. So, but at this point, the lighted candle is symbolic of the lamp that Nightingale held as she grounded at night when caring for soldiers in the field hospitals. It also signifies the nursing students' official initiation into the brotherhood and sisterhood of nurses. The Nightingale Pledge is the nurse's oath to uphold the ethical and standard principles within the profession of nursing. So at this time, we will stand, light our candles, and cite the Nightingale's Pledge. I would also like to invite any nurses that may be in the audience to stand and cite the pledge with us. All right, sisters and brothers. All our candles lit. I solemnly pledge myself before God and in the presence of this assembly to pass myself in purity and to practice my profession faithfully. I will abstain from whatever is deleterious and mischievous, and will not take or knowingly administer any harmful drugs. I will do all in my power to maintain and elevate the standard of my profession and will hold in confidence all personal matters committed to my keeping and all family affairs coming to my knowledge in the practice of my callings. With loyalty will I endeavor to aid the physician in his or her work and devote myself to the welfare of those committed to my care. Welcome to the profession of nursing.
Give me strength and wisdom when others need my touch, a soothing word to speak to them when their hearts yearn for so much. Give me joy and laughter to lift a weary soul. Pour in me compassion to make the broken whole. Give me gentle, healing hands for those left in my care. Give to my heart compassion and understanding, and to my hands skills and tenderness. Give to my ears the ability to listen, and to my lips words of comfort. Give me strength for this selfless service and enable me to give hope. Give me the ability to show the light when there is darkness. Give me faith to those in despair. Let me dedicate my life to the care of those who come my way in the hope of giving them a brighter day. Let me touch each one with healing hands and the gentle art for which I stand. And when the end of the day is done, oh, let me rest in peace if I have helped just one. That was the nurse's prayer. I would like to invite Mr. David Basil to the podium for the passing of the lamp of knowledge.
Good afternoon. Thanks for joining us on this special day. My name is David Basil. I'm up here speaking to fulfill the tradition of passing the torch to the next generation of nurses who will do the same when they take this stage during their graduation. I had prepared a joke about HIPAA, but I can't tell you. First, on behalf of all the students, I would like to take time to thank the staff and educators for their effort throughout this journey. And I'd be remiss if I didn't thank all the family members, husbands, wives, children, if I didn't do the same. You certainly all made sacrifices during the last couple of years. And if your homes were anywhere near to my home, there were certainly some tense times, maybe some tears, maybe a little arguing throughout. But we're up here doing that all honor by graduating today. So we thank you for putting up with us. So the story and significance of the lamp is a look back to early beginnings of nursing when a young British woman who was born into a life of great wealth and privilege, at 17 years of age, felt the call of God to future service of humanity. Looking for the opportunity to serve others, she would visit the poor and indigent around her family's estate, bringing them food and medicine. And despite her family's behest against what she was doing or what she was seeking to do in life, she went on to train with a family friend at a local hospital to gain hands-on experience. And then later on moved to Germany and France to continue her education in nursing. So in 1853, she finally got her chance to put her skills to work in the hospitals of the Crimean War in Turkey. Florence Nightingale had a reputation for being demanding and a staunch patient advocate, known to get what she needed to provide the best care for her patients and for the ailing soldiers. When the word of her work was reported back to British Parliament, the writer of the report was quoted as saying, which didn't print out, excuse me for one moment. Oh, that part didn't print out, sorry. So, she has been referred to as the lady with the lamp. It is to her today that we as nurses owe the honor of being in this elite class of people who have sought to serve humanity at a higher level. We have struggled and fought through countless care plans, concept maps, testing. We've suffered setbacks and reveled in our own victories. We do it all so that we can give ourselves away to those in need. Nursing is the epitome of selflessness. So today we will pass this flame to light the lamps of the next generation, which has burned since those days of Florence Nightingale, her work on the battlefield until now. So to you who have also answered this call and begun your own journey, this is the flame that signifies caring, advocacy, empathy, compassion, professionalism, sacrifice, and selflessness. I'd like to close with a quote from an unknown source that says, "Save one life, you're a hero. Save 100 lives, you're a nurse."
Just so you know, the lamp was passed to Misha Sanders, who is a first-year student, and she is our new NSA president. Mr. Hermine Carrington, he will give our farewell address.
I am so glad I took my listening pill this morning because my blood pressure is through the roof right now. All right, so hi, my name is Herman Carrington. I was also the medication math tutor for this class. I want you to all know that they're incredibly intelligent students, and it only took the slightest nudge to teach them how to do the math. They already had the magic in them. It was so easy, the easiest paycheck I ever got from South Suburban College. So, I want to thank the staff of South Suburban College's Department of Nursing for their guidance. Thank you to my classmates for the camaraderie. I can say for a fact that I would not have gotten through this program if it wasn't for all of us bonding together, dragging each other past that finish line when we were suffering from test anxiety related to overwhelming fear of failure as evidenced by hyperventilation and increased heart rate. But most importantly, and to reiterate from what David said, thank you to the friends and family that understood and were patient with us throughout our time in the program. There were gatherings and parties we couldn't attend, people we couldn't see, meals that maybe we could have cooked, but hey, let's order out instead because we need to study. Thank you for understanding all the times we had to say no to prioritize our learning and how insufferable we might have been. We'll make sure to buy you something nice when we make that nurse money. So we had the weird misfortune of starting our nursing journey at the same time as a pandemic. It was a struggle to acclimate to lectures on Zoom, both from a student perspective as well as a professor, especially considering we were learning in a field that requires face time with our clients. We've become deeply familiar with airborne precautions with these face masks, and now more than ever learn the importance of advocating for vaccines and thorough hand hygiene. If there's one thing we can say about any nursing class graduating this year, it's that we are brave. We committed ourselves to become nurses despite the horror stories of what we've heard long even before the pandemic. Long hours and nightmare situations where you could be the sole nurse on a floor of 20 to 30 patients. The tragedies of being a frontline health worker during COVID. Why would we bother doing this? What's wrong with us? We just finished our mental health clinicals, and shouldn't we be admitting ourselves to the same facilities for wanting to be nurses? But deep down, we all have something driving us. Something that's telling us, all right, I guess I could put up with like 5 or 6 or more select all and apply questions. It means I can get through this test and get to my goal. So we all have something to achieve, whether it's the satisfaction of helping a patient reach their best possible health outcomes, to contribute to our communities in feasible ways, or maybe we're following in the footsteps of a nurse that we know and admire. Hi, Mom. Or maybe it's for a very simple and practical reason, and I'm sure everyone in this room knows that reason. The money's good. Which, yeah, some of us have families to support. To my classmates who have kids and work, I have no idea how you got through this program and found the time to study. I have the utmost respect for each of you, and I hope that you treat your families to some awesome vacations. Over the past 2 years, we've been deep in our textbooks, building a foundation of knowledge for our future nursing careers. We've learned the importance of assessment, that a thorough head-to-toe exam, as daunting of a procedure as it is to memorize, is one of the best tools we have in our back pocket going forward. With the sheer volume of disorders we had to familiarize ourselves with, I now understand that slight look of terror when veteran nurses reminisce about taking med-surg classes. I can confidently say that I will not miss the lost nights of sleep trying to finish chapters on renal and hepatic disorders. But there comes a point when you look at a patient's chart and everything just clicks. The only way I can explain is something my clinical instructor, Ms. Payne, would repeat every post-conference. Every patient's chart tells a story. For example, from lab values to medications, these tell a story typical to a patient with recent kidney failure who's diabetic. To be able to interpret their bond and creatinine values, it was beautiful to see it all just come together. From OB-Peds, I learned what a fundus is for the first time and how deeply appreciative I am that I am unable to give birth. To all the women, more power to you. With complications like uterine rupture and eclampsia, as if childbirth wasn't scary enough, it is truly a miracle that anyone delivered babies prior to modern medicine. From our mental health class, I've learned that we can all use some alprazolam or lorazepam to deal with the anxiety of wondering whether a test is going to be on ATI or Evolve, and where to focus our studies. It really drove home the need for mental health services, especially in this day and age when we're paying more attention to it. Despite the pandemic and not having the benefit of being in a classroom during those early months, the past year we've built bonds that I truly appreciate. There are students that we started with that aren't here with us, but I hope that someday down the road I'll see them again, hopefully as a nurse. At some point we're going to be asked how our nursing journeys have started, so I want to take this time to talk to my classmates. I know I've done this during rehearsal, but I'm just going to go over it again. At some point, we're going to be asked how this all started. So I want to ask each of you, how are you going to remember how our journey started, aside from all the work? Forget about that. How did it all start for us? What are you guys going to remember? Are you going to remember the bonds that we built and all the friends you made? Are you going to remember the moments after a test where we would gather outside the hall and have this shared anxiety all together? I know I'm going to remember a few specific points, like a deeply misguided comment by a student that's not here during our OB-Peds class about the reason why a woman would get a C-section. I'm sure you guys remember that one. The time there was a spot that was open to witness a baby being delivered and Andrea rushing the door instantly. And I remember Ari and Ryan asking me why I didn't stop Andrea. And I can't stop her, of course not. She was so fast. But after all this, we have the NCLEX to take. It's gonna be easy, right guys? We're gonna pass the one try. But regardless, I hope I see you guys all again down the line. We're all nurses. We have that shiny RN next to our names. You know, I didn't really prepare an ending to this speech because I'm terrible at saying goodbye. One, and two, I don't know why you guys chose me for this little speech in that case. But I want to say thank you. I want to look at the staff. I want to look at our classmates. I want to look at each and every one of you out in the audience, our family and friends, from the bottom of our hearts, with all the love and support that you've given us. Thank you.
Wow. I don't know if I can follow all of those acts. But for those of you that haven't figured it out yet, I'm Dr. Linda Brown Aldridge. I'm the Dean of Nursing. I have the privilege of being the Dean here at South Suburban College. And this is what success looks like. I want to first say to the family, to the friends, to the supports, to the spouses,
To everybody, you all contributed to this success. We might not know your faces, but the faculty and I know about you. We know that you have made sacrifices. You have done some things. When this year started, I taught all the students a new word, and they had to use it even though it made them feel uncomfortable. And it's something that they really learned when they were 2 years old. They had to learn to say no. And some of you probably heard that this year, and you hadn't heard it for a long, long time, until maybe since they were in the terrible twos. But they had to learn to say that to be successful through this year. So you did a good job with learning to say no. I want to thank the administration of this college. Not everybody could be here, but President Stokes, the two vice presidents are here today with us. The deans, some of them are here, and I can't thank the Board of Trustees, and two of them are here with us today. They have been wonderful in making sure that this program and these students are supported, that we have the resources and the tolerance that we need, especially during the COVID pandemic. This is the first class who started during the pandemic, and they're finishing. And they were asked to make all kinds of sacrifices, and they face challenges that no other set of students face. And they tolerated that, and they showed their resilience and their perseverance, having to adapt, and their families adapt to them doing remote learning from home. Some of the kids had to learn how to have inside voices in order for them to study. They had to do hybrid labs and practice at home. And so you all contributed, but without the administration and the trustees saying, what do you need? And how can we make sure that we have it so that the students can be successful? We have to give them thanks and a round of applause, please. I want you to promise me that you're going to celebrate this weekend. I'm giving you an assignment. I want you to celebrate with your family and friends. I want you to give them a little extra time this weekend. I want you to enjoy this. I'm giving you that assignment because, as you know, you have other hills and hurdles you have to accomplish. But they've made the sacrifice. Some of them even got up early to come today. And so I want you to promise me that you will do that. I know that you're anxious for your next phase. This is not the end of the journey. This is just where it starts to have a fork in the road. Some of you will go down pediatrics. Some will go down med-surg. Some of you will go down forks that you didn't even know that were there. It's just a fork. Stop here, enjoy it with your family, and then know that the next signal is going to be NCLEX. And even though you're completing today, you're not finished with us. We're here to support you through that part of your journey. We want you to be successful. We'll be here to help you prepare. We'll be here to celebrate when you let us know that you've passed NCLEX. And then I have to do two more things before I present the class. I have to welcome you into the profession that I joined 44 years ago. I've been a nurse that long, and like Dr. Herbert, I've been through those days. But what makes you get up as a nurse each day are those patients and seeing that you've made a difference. What makes me get up every day is seeing this being success. Nursing is the most wonderful field. You can do all kinds of things. And my nursing journey started with an associate degree, just like you guys. And I think I told you the first time I met you, I didn't see failure on anybody's forehead. This is what I saw, which was success. So, with that being said, I'm going to give a little instructions, because you would think as the dean I would give instructions. I'm going to ask the family and friends. You notice we didn't tell you could cheer. I loved hearing the cheers. But I'm going to ask you if you would remain seated while the class recessed, and then to join us in the lobby, because we have some lighter refreshments. We have a photographer there to take pictures and to enjoy. But we really would like the students to be able to recess out of the auditorium. Okay.
I know Dr. Brown-Arich is ready to go, but I would be remiss if I did not stand to thank her. 2 years ago, Dr. Brown-Arich joined us here at South Suburban College, and this is her inaugural class. And so as her supervisor, I want to say I couldn't have a better employee. She came here very committed, very focused, very strategic about what she wanted to do with this program. And I'll be the first to say that our program was not in a very good place when she came. But because of the support of our president, of our chairman, of our trustees, Trustee Rogers, Trustee Reed that is here, we are proud of this program today. And we are proud of these graduates. And what I said to Dr. Brown-Arich when she got here is that I am not a nurse. I cannot lead this program. I need you. And she has come in and fulfilled everything we have asked her to do. And I am so proud of her. I am so proud of the work that she has done to turn this program around. I am confident that we are going to have a 100% pass rate for NCLEX for the class of 2022. Thank you, Dr. Brown-Arich, for giving up yourself, for giving up your time to us and to these students. Thank you.
Thank you, Dr. Williams. She knows I'm not really a bashful person, but I like to give accolades to others. That's part of being a nurse, you like to give to others. So thank you so much. The other thing I have to do is there's the people in my department and in my faculty that support me. And one of the faculty members couldn't be here today because she's sick. And so I would like to acknowledge Naomi West because she contributed to this success. The other faculty are here and you got to meet and see them. I also have to tell you, I have really great support people. And Brandy Faulkner, who is our lab supervisor, she had to be at her daughter's graduation, so she's not here. And she contributed to this success. I have one of my adjunct instructors who's here, Marie Perez, and she contributed to this success. I have someone who took on an extra job to help my program be a success. Ms. Alicia Hill, who is the manager of BMAP, and she took on being the clinical coordinator. And then I have my two right hands, left hands. I have Ms. Mitchell, Patricia Mitchell.
Miss Joanne Mabry. Because all of this couldn't happen. None of this couldn't happen with this whole big team. I'm a big team person. And so my team helped us to get here. And yes, this is my inaugural class. The year before I came here, they had 4 graduates. My first year here, we have 22 today. And so I am extremely proud. And I'm gonna ask the class to stand. This is success. I present to you the class of 2022, the graduate nurses from South Suburban College.